Hi, everyone. I think that most of you know me. My name is Justina. I'm the VP of Business Development at Microwize. And thanks again for joining us. So what we're going to be going over today, I have with me Dr. Nesma Mansour, who is our trainer on Aprima. And we're going to walk you through the Aprima software, which, to recap, is an integrated all-in-one solution. Everyone on this call is either a Medisoft clinical user or a Lytec MD user, where you have your practice management system in a separate software and you have your clinical system in a separate software. And the two systems are bridged. So Aprima is just one application. It's your practice management, electronic health record, billing, and scheduling system all in one software. So you're really omitting any issues with the bridge, which many of you have been using the software for many, many years. And I'm sure that you have experienced at least a handful of times where the bridge goes down and your patient appointment doesn't transfer over, or the patient itself doesn't transfer over. You're not going to have any of those issues with Aprima. So Nesma is going to walk you through the system, starting with how to create a patient, how to collect copays. Then she'll show you how to chart a patient note really briefly. And if you have any more questions on that, or if you want to go more into depth on that, we can schedule a private session so that you can ask more questions and get a feel for the templates. We can even recreate something for you similar to what you're using in Medisoft Clinical or Lytec MD now, so that you can compare them both. We'll also go through electronically prescribing a medication. And then Kim, who's our billing specialist, will show you how to send a claim in Aprima. And that's it. So I'll hand it over to Nesma from here.
Thank you so much, Justina, for this great introduction. And thank you all for attending this session. And I hope it will be beneficial and answer all your questions. So let me start by sharing my screen. And Justina, please, whenever you can see my screen, please let me know.
Okay, you're live.
Okay, sounds great. So as Justina mentioned in a detailed way, that Aprima is an all-in-one solution. You will forget about bridging issues to software, the not so smooth experience of having the patients and information moving from the clinical or EHR portion and the billing portion. Also, Aprima has, whenever you have Aprima, you have unlimited number of users logging in at the same time. So, and the users, of course, will have their own customized access rights and security. So each user with their job description will have their access rights and security. As you can see my screen, whenever you log into Aprima, each user page or desktop, which is the Aprima desktop here, it's different than the other user. And it's very beneficial to have what actually the user will need to utilize in the practice. So all of these desktop items are customized with a list of functions that can be beneficial for you. So I had like a flower from each garden. Like they say, I have the calendar in here, which will show me the specific date I am choosing for the patient that are scheduled. Then on the lower section, I have the PI tracker for MIPS. In the middle section, I have the messaging center, which will be touching on for internal messaging between the practice staff, patient interactions through the built-in patient portal, and the interfaces with any lab, radiology, facility, and so on. On the right side, we have the new prescription queue. It's a new feature that improves the speed and the efficacy of refilling medication. This feature allows the providers to work all prescriptions in one window, including prescriptions on formulary, prior authorization, electronic prior authorization, manual refills, and change requests. And on the lower right section, I have the visit center, which keeps track of the specific provider incomplete notes to work on them and start documenting the notes and complete them. So first thing, scheduler or the calendar. So I will be wearing multiple hats today according to your practice user or your practice employee. First, I will be wearing the front desk hat or the registration team. It's very important to be able to deal with multiple schedulers, especially if you have multiple locations, multiple providers, if you have on-site visits like home or specific nursing facilities. This is where Aprima help you to customize your calendars. So I will touch on the go-to scheduler here. And it will give me this view where I can use this magnifying glass to choose my customized built-in calendars. It can be a provider-specific, location-specific, related to a certain service site, like your multiple locations or certain facilities. I can view as many calendars as I need. So if I'm selecting like Mountain View, nursing home, and Dr. Patterson calendar, which I have here as a demo, a provider, click OK. I can choose from here the date that I want to view, and I will see the calendar side by side. Each calendar will be color coded with a specific color, as well as the appointment types where it has a color code, specific duration. It can be linked to a specific orders, like allow patient to request this appointment type through the patient portal, or having a cancellation charge linked to this appointment type. If you want to view a work week or a full week, you can choose a one calendar per time, like this one. And you can see that work week and full week is no longer grayed out. So you can see your week calendar. Also, you can change the date. You can have your full week. You can drag and drop appointments from your waiting lists, as well as clipboard if you want to copy and paste certain appointments. To schedule a new patient or an existing patient, either the patient is like existing in the practice or I will create a new patient chart, all I need to do is hit on the appointment slot or the time. It's really easy. You can see I don't have like the best choice of color in yellow here, but you can choose the appointment slot duration, like I have it here in 15 minutes. If your visits is longer or shorter, you can change it absolutely. I can click or hit on the 2 p.m. here, and it will open a new window for me. And I can open as many windows as I need in Aprima. I can minimize it, return back to the calendar, or you can see here I have 3 windows open here. Under appointment, you can choose to schedule a patient visit, a certain event, a blocking event, or a group visit. So if you have like a group therapy or you want to schedule a group of patients in a certain facility, you can choose group visit. As we have chosen the time slot from the calendar, you can see that the provider calendar, the appointment date, the time span is defaulted, but you can always change them. Yellow fields are the required fields to set an appointment, but we can always customize your required fields according to your practice preference. When I click on the magnifying glass, I will choose the appointment type, which, as I told you, it's color-coded. It has a duration. You can allow overbooking, and you can link it to a cancellation charge. I can choose like here, follow-up 30 minutes. And then under patient information, you will choose also the magnifying glass and have your find patient window here, where you can search using all of these criteria, starting from patient ID, medical record number, last name, and one of the commonest way to search, which is date of birth. You can include inactive patients as well. So the question here, how can I schedule a new patient that are not existing in my database without getting out of this appointment window? You need to click on new. And it's whenever you get hold on the workflow, you can see that the pages are similar. The workflow is very smooth. When you open a new patient window, you can add only the required fields, which are highlighted in yellow, or you can add as many fields as you want. Required fields also in the new patient icon is customizable. So let's say you need every patient email to be existing on your patient chart. Then we can we can teach your practice admin as well to change the required fields. We can scan or import or actually snap using like a desk camera, the patient photo. You can scan your driver's license, as well as we have an additional chart or additional information where you can allow electronic medication history consent. You can have like a patient partner consent, patient access, and of course, we have the chronic healthcare also as well, or the CHC. When you click OK, the patient is created in your practice. So I will choose a random patient here, which is Mrs. Linda Bailey. And as you can see, whenever we schedule a patient, I can view like a patient alerts. So this is a patient alert that's linked whenever I schedule a patient. This is a function. We can see that the phone number populated. Also a great feature, you can see the RX benefits if you download them, as well as the last eligibility that was done. You can click on this hyperlink and view the real-time electronic eligibility. Of course, I'm using a demo database, but in real databases, you can see the patient coverage and service eligibility. So this is how easy scheduling a patient. When I click OK, I can see that the patient will appear inside my scheduler. So this is how you schedule a patient, create a new patient. Let's touch on collecting copayments. You can collect copayments in many stages of your visit, like on checking in, on checking out, after receiving your EUB, depends on your workflow. So one of the ways to collect a copayment is through the scheduler. If the front desk loves to like have her comfort zone or his comfort zone inside the scheduler, can click on the appointment type from here. We will have the same appoint window as well as these additional tabs. Go to account and add your copayment amount as well as the method, if it's a cash, credit card, as the batch, which will be your electronic envelope for your financial transactions every day, as well as notes. The system can be integrated with credit card terminals where you can either add the credit card information inside the system after having the patient consent, as well as integrated electronic chip readers. You can also collect payments like advance payments, deductibles, patient balance from the same window on the lower section of the screen. So this is how we can collect copayment in the system. Let me get back to the desktop and speak a little about our messaging center. Our messaging center is where we can create filters, or I prefer to call it folders, where we have the certain messages segregated into different folders. So I have my messages as a provider. I have the lab results, phone calls, like if the patient left a voicemail or a phone call or so on, and can be entered manually by the front desk team, as well as health maintenance. It can give me alerts for specific like due dates for MIPS especially. So also under this magnifying glass, I can have as many filters as I need, and I can create newly customized filters like refer requests, like schedulers, and there are reports where you can automatically have reports on a scheduled basis and send to your method, like a specific deposit slip report, which will be very helpful for the billers, scheduling reports, and this will run automatically in your backend and send you a message like this showing you your kind of report that you have scheduled. Messages also can be an internal way to communicate between the practice employees, like specific tasks that the employees share. And so prescription queue, which is a new feature in the system, it can show you the requests and all the other things we mentioned earlier. You can click on the patient and you can view what medication in the prescription queue, and can scroll down here. We can make it larger. We can see the date of birth as well as the insurance information. And at the end, we have this visit center where you can access your incomplete notes and work on them. So let's start and see how a note look like, or how a provider, MA, can access the note. So there are many ways to access notes. You can search for a patient and open a note just like you open a progress note in MD or clinical. You can start a specific note from the desktop. If you have let's say we are starting this appointment for Mrs. Horner, I can see some information in here, like this is saying the eligibility is processing, third-party collections. I have a couple of patient information, one patient summary, the type of the visit, as well as the calendar for the provider. I can create a new note, and the notes here, you can have one generic note, you can have multiple notes. This is an auto refresh, and this is why it blinked like this to make sure that your desktop is synchronized. So, and you can turn it off, of course. You can create like a generic note. You can have your template notes. You can change a medication. You can send a prescription, create a super bill manually. So it's pretty simple. So when I click on create generic note, it will give me any existing incomplete notes, just like a reminder. It's telling me that there's an incomplete note from 2015. If I want to open it, I will click on this hyperlink. If not, I will click on new. And how you can access a note, it depends on your access rights. So if I'm on the clinical team and I have the access rights to open a note, I can do it. If not, you cannot add or complete a note. As you can see here, it's a bit different from what we are used in MD and clinical. We have the vitals, the palettes, and all of these great tabs in here, some sliders on the right and the left of the screen. So let's start by vitals. If we, as a clinical team, so I'm wearing the clinical team hat now, want to record the vitals, but as well, I want to follow up on the patient previous vitals, which is very important, especially if the patient is hypertensive or have some sort of fever and you're following up. You can click on this flow method, which will enable you as a clinical staff to view each patient previous recorded vitals, okay? The way that you document a note is you document on the lower part of the screen and it appears on the upper part of the screen. You can enter the weight. You can choose if it's dressed or so on. You can enter the height and it will automatically calculate your BMI as well as count the measure against your MIPS. So, and we will talk more about MIPS. Temperature, you can add the patient temperature, you can add the method, as well as the rest. On the right side of the screen, we have something that's called special vitals or customized vitals. So as podiatrist, for example, I need to have shoe size, for example, or if diabetic foot examination was done, or any set of vitals, I can have pain scale. For pediatrics as well, I can have the occipital circumference or mid-arm circumference and all of these good things. So customized vitals is here for you, okay? Then we have the palettes. And let me touch on something before going to the palettes, which where you can hover over between or jump between all of these tabs and not in a specific like order or anything. Everything will be documented by the end of the note. So if the nurse practitioner or your MA is just collecting vitals and history, for example, can access history right away, check the patient history from this left side of the screen. As you can see, it will view all the patient past history. This is, for example, the problem and diagnosis history, which will show the patient past history. It will show the onset and any documented thing and record the date, of course. If nothing changed, anything that you need to do is just check mark that you have reviewed it. Medication history, a very important tool that's needed by a lot of providers, which you can record manually patient medication history. You can download the patient electronic medication history from SureScripts database. And if you have a medication that was stopped by you, that like was prescribed by the provider and stopped, it will show here under medication history. In order to add a medication history, you click here and then you will type the medication generic or trade name. You can specify a specific SIG for the medication or not. Then we have all these history items, which is 100% customizable. If you have a specific set of history that you want to ask about, we can build it for you. And as Justina mentioned, we can copy something that you utilize on clinical or MD and show the difference between documenting on both softwares. Social history, you can record like a very important item for tobacco history, which is very helpful in your MIPS reporting, as well as all of the questions either that comes with the system, like you see here, or customized according to your needs. One more thing that I want to touch on, which is the immunization history. Immunization history tab is an interactive immunization card. The system comes with a pre-built CDC updated pediatric vaccination card as well as adult vaccination card. As you can see, we have the set of adult vaccination card here. I can change it if I click on pediatrics. I can add the vaccine type. SO and SP means that either it will be ordered on upcoming visits or it's done during this visit. You can type the administration date, a reason for refusal, history source. You can add a funding source and everything like this. You can also have a barcode scanner form, which will import all of this, or a barcode scanner, which import all of these items automatically while scanning the barcode on the vial. Also, if you have an immunization registry interface, you will be able to export all the recorded vaccination as well as download the history of the vaccination from previous other facilities on the registry by using input history. And then all of the other history items, as you can see. If this is recorded by the nurse practitioner or the MA, or recorded by someone else, and the MD or the provider would like to go on and complete the note, the MA will have to click on OK. And when clicked on OK, click on incomplete note in here, and then can forward the message right away or send a message for approval. And forward the note for cosign and approval. This can be done if another provider will cosign and approve, and very helpful if you have interns in the practice. Click OK. You can change, like, you can have this appointment status changed to ready to discharge, or we can keep it as it is. Then click OK. Then the provider or the nurse practitioner or whoever is going to complete the note can either view it under the visit center from here. As you can see, we have a visit date, or can access it as well from the same calendar view by clicking plus and view incomplete note. It will give the same view as the MA. The provider will be able to view the vitals, click flow, view all of the previous recorded vitals, click history, just mark the reviewed items that it has been recorded, and then start to document the note. So first thing I would like to start with is palettes. And palettes is something that's pretty similar to templates in clinical or in MD. But the great thing about palettes is you can customize it yourself while documenting a note. So let's say, for an example, the provider has like a Medicare annual wellness. Okay, I can have a set of a specific chief complaint, a set of a specific diagnosis codes, ICD-10 codes, and import specific assessment to this visit. Also, if I have like a common problem that I usually see in my practice, like common cold, okay, or upper respiratory tract infection, influenza vaccination, if we have palettes for podiatry, for example, like fungal nails or nail extractions, and all of the other specialties, I can build the templates, or our implementation team can build the templates for you, where all you need is to import these templates or palettes in your note. So let's try and choose one of this fatigue one, for example. I can see that chief complaint is built as fatigue, have physical examination, and we have review of other system, diagnosis codes, orders, So even orders can be defaulted, plans, patient instructions, medications, or assessment forms, everything. And you can import multiple palettes if you need. All I can do to import a palette, select all. And moving through our tabs, we can see that chief complaint is fatigue. If I want to add something else, so this patient is having a fatigue, but actually have difficulty in urination or dysuria, I can add it in here. You can have your chief complaints built as this, like dysuria, or any like fancy medical word, or some practices prefer to have it in patient own words. So whatever you prefer, we can add it to you. Then we have the chief complaint. We can see that fatigue is documented because I just imported it from our template. But what if I want to change the quality to acute? It's not something chronic. I can come here, click acute, unclick chronic, and that's it. I have all of these good tech categories. I can go over them and choose these things. Same idea for dysuria. I can go on and start documenting. Yeah, it's acute, it's gradual in onset. No, sudden in onset. I can add the onset of this symptom, which whenever you have a underscore like this, you can type your number. Alleviating factors is medication, exacerbating factor is exertion, and you can add all of the associated findings as well. Review of other system. You have here we have like pretty comprehensive review of other system, and it's arranged from head to toe. If you are one of the practices that collect the really generalized review of other system, we can have a set of defaults. What I mean by defaults? It means that this, when I select all, like here, it will come up with basically normal findings that I have pre-recorded in the back end without having to go through each system and choose like no, no, no. Okay. If you want to click no on all of the findings, you can click from here and it will appear in your section. Okay. If you have a specific set of review of other system, it can be built as well. Same thing about physical examination. As you can see, it's pre-populated from our palette that we have chosen. You can have multiple physical examinations. Like here we have like podiatry examination, which has like constitutional, musculoskeletal, left lower extremities for musculoskeletal, right lower, and dermatological or integument as well. We can build as much as we need from our examination sets. Here we have rheumatology, can have cardiology, and so on. So this is how we add the physical examination. You can also have a set of defaults to add all the negative findings if needed. If any positive finding, like in constitutional, general appearance, I want to say that this patient is obese and android. I want to say that in respiratory, I can say a dull left upper lung field, and you can see that the positive findings will appear in bold. Assessment forms, a great way to have your questionnaires that the provider asks on the visit or during the visit built into the note. We have a pre-built variety of assessment forms that comes with the system, and we have it in Microwize library for different specialties, excuse me. So if I want to choose the PHQ-9 and I want to choose the 4-risk assessment, which will count against your MIPS, the questions in here, yes and no, and we can choose as many assessment forms as we need. It can have multiple views if needed. So let's check the PHQ-9. Some assessment forms come with automatic calculator, and we are working on the multiple assessment forms that automatically calculate the score for you. Results tab. For the results tab, we have the integration interfaces. You can view all of the incoming labs or radiology through interfaces, or can record it manually through adding new results. The system also comes with a feature that calls lab template. So if you have something like in-house urine analysis or in-house drug testing, you can build the template. So I will click urine analysis, And you can build a template and start documenting it right away. So let me see if we have something built in this database. Allergy test, for example. So we can see this is an allergy test. I can record the results. I can have the value. I can add range for like normal and abnormal and so on. Click OK and it will be saved. You can also view previous results from interfaces. Like here I have this CBC that was received on 2008 and can view all of the findings. It will highlight the abnormal findings for you and can be approved by the provider. Diagnosis code. The system comes with an integrated IMO diagnosis search where you can click on this magnifying lens and start searching using certain diagnosis code, either by the code itself or by the description, okay? And you can have a variety of specific codes. Also, we can build specific categories for you where you can just click on the pre-saved code, okay? The adaptive learning of the system appears in this part and in multiple parts of the software where the system learns what you actually do. So frequently used diagnoses, it will be created along your documentation. It will create a specific list for you as frequently used diagnoses. Also, the system will create a patient list for the previously documented or previously added diagnosis codes for this patient. It will be very helpful if this patient is having like an ongoing problem or a chronic morbidity and so on. Just clicking on the code and it will appear right away.
Let's take a short pause here, Nesma, so you can have a quick breather. Dr. Rossi and Lisa, do you have any questions, any comments on what you're seeing so far?
Well, I think that for me, we'll probably need a lot of specialization. This is all general medicine. As a surgeon, otolaryngologist surgeon, I really have specialty diagnosis codes and special exams that I do. So it will need some customization.
Yes, definitely. And since we're familiar with your note content, that's something we can probably handle like maybe 90% of on our own during the implementation process. And then of course, we'll have a period where we train with you on how to use it. But because you're familiar with the content, even though it's a new system, it's not going to be as difficult for you to grasp.
Okay.
And Lisa has a question. Yes, there is a cloud-based version which can be accessed through a web browser and also a server-based version of Aprima, correct? All right, Dr. Nesma, back to you.
Thank you, Justina. Thank you so much. Then we have the prescription module. So instead of going out of the note to prescribe a medication, you can prescribe right away from within the note. Also, you can prescribe without having to add a note. The system comes with electronic prescription as well as controlled substances, PDMP reporting. It can view the patient active medications and history of prescribed medications. Under prescription, we can save a default SIG for the commonly used medications. So whenever you select a specific medication, it will come up with the specific SIG you use, but you can actually change them right away. So when I chose this Lipitor, it just came with like take one tablet every day and so on, but I can change it as I needed. You can add a start date, an end date, provider name. Then the pharmacy will be automatically populated from the patient information, but it can be changed as well. Whenever you prescribe a medication, you can have lactation precautions, geriatric precautions, drug interaction precautions, and you can view formulary. You can see the precaution screen. You can add a reason to override. You can prescribe as many medication as needed. And in this page as well, you can choose a specific medication to discontinue or refill with just a touch of your mouse without having to go back and forth through medications. You can refill it with the same SIG that was documented in previous visits, or you can change it right away. You can send the medication electronically while documenting the note by this button over here, which says save medication, save note, and send medication. You can print the prescription, you can send it electronically, or you can choose not to send due to pending formulary or pending prior authorization. Moving to orders, this list means that you can have your interface orders. So by one click, this will be sent right away to your interface, either a lab or a radiology facility. You can have specific order requisitions to be printed, and it can be linked to an order. So you will send the order and it will send a task to, let's say, the registration team to print an order requisition. Also, you can have a referral. And part of the referral is something that the system is very unique with. It's dynamic procedure note. Dynamic procedure note is whenever you select a procedure, you can add another like depth into this procedure. So I just selected referral, but nothing of this was added. Like I can send with the referral a CCDA directly from the system to the provider through electronic faxing or a direct mail. I can add the provider or the facility name, and I can have a list of external providers. I can add any items that I need to be recorded on the referral. Very important section where it will allow you to fulfill your PI category for MIPS reporting for outbound and inbound referral and closing the referral loop. You can print an order requisition as well for the referral. Procedures, which is basically the procedures that was done during the visit, as well as the evaluation and management codes. It depends on the practice workflow. So if the provider will be adding this to the note, or it will be saved or defaulted on the note, it will populate on your electronic superbound. Okay, we have a list of categories. We can customize your like procedure codes and CPT codes that you have in your practice. Plan, we have multiple views of plan. So this is like a more interactive way of having the plan. You can see that every item that was documented can have like a saved plan. So this is a plan for upper respiratory infection. You can see that it has like notes, diet follow-up, recommendation, exercise, or there is a classic view of the plan, which I can't access right now on this patient, but I can view it, where you can see if quick texts like macros, click on like, let's say, upper respiratory tract infection, and it will come up with your diet, patient education, and everything. At the end of the visit, this is how the visit text look like. It will populate everything that was documented, if needed, to a text that can be printed, saved to PDF, or faxed out to a specific facility or a referring provider. Visit text is interactive, where it pulls all of the information that was documented. So, and the verbiage, of course, customizable. So we have here that the patient presented with fatigue and so on, review of other system, the vitals, date and time stamp, and recorded by who exactly, the examination, the assessment that we performed. We can also add the assessment results, as you can see here, the 4-risk assessment results, codes, medications, and the results associated with this visit. And once it's completed, it will be electronically signed by the provider. One good thing about visits is allowing you to view previous visits on the same page. So we have this slider in here, which is follow-up slider. Let me pin it and talk briefly about it. The follow-up slider enables you to view previous notes that was documented for this patient, to see specific chief complaint, review of system, specific medication, and so on. You can actually import these items to your existing note. So if this patient is still having the cough, I can unselect all, select the chief complaint from here, and click on this pretty arrow, and the cough chief complaint will be here without having to redocument it. This applies to all of the visit items. Another slider is the education forms. You can have patient education forms saved in here, printed or sent via the clearinghouse. Here under visit information, this is where it shows you the billing provider, the rendering provider, and so on. And clinical decision support is basically your health maintenance tab. Let me show it to you. In the system, we will build rules for you, the item that you document for MIPS, where you usually document. And these rules will have specific, like it will be, let's say mammogram, for example. So there will be a rule saying that mammogram need to be done for patients above 45, female patients each 27 months. Okay, so it will give you like a due date like this and tell you that you need to order it or perform it. Okay, so this is basically clinical decision support is health maintenance page. Once the note is documented and completed, click OK and save the note as completed. As you can see here, once I save the note is completed, the super bill will be automatically generated and ready to review. If you prefer that the billers work on your super bills, even though the note is not completed, we can change this on the backend. And click OK. It's giving me like an alert saying that there's a missing E&M code. You can select an E&M code if you click yes, click no. And this is how you document a note. Okay. So let me get out of here and go briefly through another function, which is document generation. Whenever I open a patient chart, either clicking on a patient hyperlink from my desktop or search for this patient through the find icon, I can have something that's called document generation. This can be accessed through the note or outside the note. By document generation, you can have or save a specific consent forms, patient intake forms, things that the patient actually will be filling in or fill in previous to the visit, and like HIPAA consent, anything of this matter. And the patient can sign them, fill them while in the waiting room, or can be shared through the patient portal. So let's say I will go here and go to this HIPAA consent, click OK, click on preview, can be filled in by the front desk or the patient. Signature can be added through like tablet or electronic signature pad. Click on file and save it, and it will be saved under the patient attachment. Very useful function to generate documents and go paperless. Another feature that is scanning. Scanning, either you scan into a patient chart, so a document per patient, or you scan or patches of document and then start linking. The system has its integrated scanning module without having Zoom and all of this hassle. Okay, then I would like to notify you regarding MIPS. So Aprima is certified 2015 EHR, where you can send electronic clinical quality measures as well as participate in promoting interoperability and improving activities. The system comes with a pre-built set of clinical quality measure reports, so you can keep track and your practice staff can keep track of your performance. You can have this report to fix the patient that didn't fulfill this specific measure, and it will show you your population, numerator and denominator. Here on the desktop, I have like a real-time promoting interoperability tracking. You can set a specific date range like these 90 days or the current year, a custom date, and it will keep track of my progress in the promoting interoperability. Under reports, the system comes with a variety of reports. One of them is clinical quality measure, where we will assist you with building your clinical quality measures, setting them up for you, so the system will count it against your documentation. And we can keep track using all of the electronic clinical quality measures, the ECQM's measures in the system, okay? As well as saving specific filters for reports. Speaking of reports, even outside MIPS, the system comes with pre-built reports basically for everything. You can have reports for demographics. You can have clinical reports like how many this diagnosis was added or a specific medication audit. You can have a billing or PM reports like account receivable for the AR tracking of insurance, patients, total, balancing reports to check the deposit slip daily. You can schedule this to be automatically run and sent to you on your inbox every day by end of the day. You can have scheduling reports like appointment statuses. You want to keep track how many patients were confirmed and how many patients canceled and so on. If you have another report in mind that's not here, we can assist you building a customized report. Then the last thing I want to touch on is the billing portion of the system. So as we mentioned in the beginning of this demo, Aprima is an all-in-one software. So the billing information, the demographic information flows smoothly between the clinical notes and adding them and the superbill. Whenever a provider complete a note or start actually with a note even without completing it, a superbill will be automatically created that will have the patient recorded diagnosis codes from the note, as well as the procedures that were added. The billers will have this great billing drop-down menu where they can track superbills. They can have their own like filters, like specific date or specific patient, specific payers, superbill statuses to review. And the billers can come in here inside the superbill, view the patient information, like the rent or the visit information, actually, like the billing provider, rendering provider, change them if needed, view the account information for the patient insurance, run real-time eligibility if needed, check the diagnosis codes, add missing diagnosis codes if needed, change the arrangement, add specific modifier, change the fee schedule. So building fee schedules for multiple insurances is pretty basic, and complete or set this superbill to be sent to the payers either electronically or on paper. System comes with an initial scrubbing function, which is validation. The validation initially scrub your claim for demographic errors, like missing, let's say, address or incorrect one, also missing provider NPI or any sort like of an initial scrubbing. If the superbill is validated, it can be set in a queue of sending the claims either automatically, so you can have your claims sent automatically in a specific time of the day, or manual. Also, the billers will minimally need to access the clearinghouse, which is eMedics, because everything you have like a mirror image of a simplified workflow inside Aprima. You can track your rejections and denials from superbill reports, where you can see them, work on them, and resubmit the claims. Also, you can track your ERAs and electronic payments. The system will automatically post these ERAs for you, but you also have the functionality of manually posting payments that you are not enrolled with ERAs. So this is basically the item that I wanted to cover. Please let me know if you have any questions that I can answer or assist you with.
All right, so we'll open up the floor now for any questions. Thank you, Nesma. This was a really comprehensive demo. So I'm sure if there aren't any questions now, there will be, because there was a lot covered today. So Dr. Rossi or Lisa, do you have any other questions today?
No, I don't. I'm going to have my secretary view this, and I'll probably like to view it again. And I'm sure that we will have questions after that second look.
Okay. All right, good. So yeah, as far as next steps, I would say you probably want to get a little bit more familiar with the system. So you can reach out to the sales team at salesteam@microwize.com, or by calling us 201-322-4100, option 1. On the team, we have John, Dina, and Ken. They were all trained and supported by myself. So you're in good hands. And if you have any other questions related to implementation or the software, the transition, feel free to reach out to us. I just want to recap that Aprima is owned by the same company that supports Medisoft, and Microwize is supporting Aprima, and the same staff that you already know will be working with you throughout the process if you decide to go that route. You can also find more information on microwize.com/Aprima. Just to remind everyone, we do have a limited time offer for Medisoft Clinical and LITech MD customers, where your whole training and data conversion can be included, and the licenses are at no cost to you. The maintenance fee that you have been paying for Medisoft Clinical and LITech MD will be matched for Aprima. Aprima is actually a more expensive software, so this is a great deal for everyone. And that's it. Thank you, everyone, for attending. Have a great weekend.